So good morning, everyone. I am Gina Sudam. I see my cat in the basket behind me. Um, I'm Gina Sudam. I'm the president of the Wyoming County Chamber of Commerce. And we have our Restart, Rebound, Rebuild series this morning. We have two guests joining us this morning. We have Dwayne Noggle, who is heading up our local area 2020 census. And we have Anne Marie Stevens, who is the CEO of Tyler Hospital. Dwayne is he can only be with us for a brief time this morning. I've asked him to give us an update on the 2020 census numbers and tell us some more information about that. So I'm going to unmute Dwayne so that he can share with us some information about the 2020 census.
Good morning, Gina. Thank you. As Gina said, my name is Dwayne Noggle. I'm the Census Partnership Specialist for Bradford, Wyoming, Susquehanna, and Sullivan counties. The reason that Gina brought me on this morning is to talk about Wyoming County. The census is very important to rural counties because that's where a good portion of our funding comes. Currently, the Wyoming County response rate is at 50.8. Now that puts us about 10% below the national average and 13% below the state average. And to put it in a little bit of perspective for you, based on the 2010 census, in 2015, the state of Pennsylvania received $26.7 billion, that's billion with a B, from those census numbers. Some of the major programs that they funded were Medicaid at $16 billion. We're looking at the Medicare Part B at $2 billion. Highway planning and construction got $1.6 billion. So that money is very important to us. We currently have some problem areas in the county that we're trying to reach out to: Overfield, Exeter, Braintrim, Mashopin, and Forkston townships. We need them to come up with a little bit more with their numbers so that we can help the county get the funding that's going to be derived from the actual census count. You don't need a formal invitation to partake in the census. Most folks are waiting for a paper form. Well, they changed it a little bit this year. There are 3 ways that you can respond. You can go online at my2020census.gov, or you can call they have a customer service number at 844-330-2020, and someone there will help you complete the census. They ask you for any identifying information. It's just going to be a name and a birth date. There'll be no social security, no banking information. Everything is confidential. It's not shared with any other agencies until we get the final report, and then when it is shared, it's only shared as percentages. So your personal information is protected. But the thing that we need to concentrate on most is getting folks to take part in the census so that we get an accurate count of those folks that we're going to serve in the county.
Dwayne, how can we help, especially in those areas that you mentioned? What is being done in those areas to encourage them to fill out the census, and what else can we do as a community to help get the word out?
Basically, talk to your friends about it. Ask them if they've completed the census. Make sure they understand that there is a lot of money for the county that's riding on every taxpayer within the county filling out the census. The COVID-19 has put a little bit of restriction on us for ground operations, and we got a little bit of a late start, but we're completed now with all the door tagging operations. In other words, those addresses that couldn't be verified, or those residences that got mail at a post office box, have had somebody come by and drop off the paper census form. So we're waiting for those forms to be completed and sent back in. But the biggest part is sharing it. Share it on social media. Share it with your friends when you get together. Ask folks if they've done it. Make sure that they understand that, they use a specific number of about $2,100 per person for benefits that result from completion of the census. So when you start looking at the number of people that we miss, that could be a significant amount of money that the county does not get, or that the individuals don't get, depending on the program, to help us support the county and support ourselves.
And what kind of funding, what kind of programming does the census fund? So I know you mentioned a few things earlier, but you know, can you bring it more local? You talked, you know, big picture about Medicaid and things like that, but can you bring it more local to some of the services locally that are at risk of losing funding?
The National School Lunch Program, Head Start, Early Head Start, our emergency services.
Great.
We're looking at WIC.
Those are great examples, and certainly we have seen the need for those programs, especially, you know, the WIC program and the other food programs in our community during this time.
Yes, and it also involves Section 8 housing vouchers, the SNAP program. So there are a lot of programs that come into play that you wouldn't think that get their funding based on the numbers from the census.
Great. Well, I thank you for being with us today and bringing our attention to this. The Chamber is going to focus on this a bit in our outgoing communications on our social media and some of our other outgoing communications. We have been adding it in, but sometimes with all this going on in the world, it gets things can get lost in the shuffle. So this may unfortunately have been one of them. We will continue to try to promote this and also maybe help some of our other partners with ways that they can help and share and promote the census. So I thank you for your time today. I know you have another meeting at 9:30, so I don't want to hold you up from the commissioners meeting that you have. And I thank you for coming on this morning on such short notice and being able to talk with us about the 2020 census. And we'll get those filled out.
Thank you, Gina. I appreciate it. Have a good day.
You too. Thank you, Dwayne.
Bye.
Bye now. All right, so we're going to move along now and talk to Anne-Marie Stevens, as I said, about rebuilding healthcare. And what we mean by that is obviously we're in our rebuild segment of this series. And we wanted to start talking to specific industries about what steps they're taking and have taken. So Anne-Marie, good morning. How are you?
Good morning, Gina. Thanks so much for the opportunity to talk today. I really appreciate getting the message out to everyone. And if anyone has any questions, please feel free to ask.
Yes, so we have the chat box is open. If you would like to ask Anne-Marie a question, type it into the chat and we'll get to your questions today. I'm going to start with a list of questions that I've developed based on things that I'm seeing on social media, things that I'm hearing out there in our community. But first and foremost, I want to give Anne-Marie the opportunity to tell us what changes have been made at the hospital to prevent the spread of COVID. And I know that we did talk to you about a month ago about some of those changes. So I want to see kind of what's been ongoing for you as far as the changes that you've made.
Okay, thanks, Gina. I do have like a kind of a long list here of things that we've been doing. And I want to go over all of them because I think what it indicates all the way along the line is that we've changed things based on our situation. And I think that's one of the most important things to take away from today is this opening into the green phase is new to us again. So some of the things that we've implemented in the past, you know, may need to change or may need to stay the same for a while, but it's all going to depend on what the incidence of COVID remains in our community. So we'll have to continue to monitor that. But I wanted to go over some of the things that we've done. So early in March, when we first started addressing the COVID virus, we took the direction from the CDC, the Pennsylvania Department of Health, and the World Health Organization, and first started limiting our access points to enter into the hospital. Our patients and physicians entered through our main entrance, and our employees entered through our rear entrance, just so we had a little bit of control and knowing and being able to put in screening mechanisms of all who enter the hospital to make sure that we keep the hospital safe and less chance of spreading COVID virus. So with that, we developed screening sites at both of those areas. And at first we were screening just basic questions when people were entering. Had they had a fever, short of breath, cough, had they traveled recently? At that point, it was if you had traveled out of the country. We found that going into it further, we reevaluated what we were asking, and we included more things, and we also added temperature monitoring. So every patient, and that's as of today and going forward for right now, we monitor every person coming into the hospital, whether it's patients or staff members, so that we're assured that they do not have a fever, and we're considering a fever of 100 or over. So in addition to that, some of the symptoms that we're monitoring, that we're asking people is cough, shortness of breath, difficulty breathing. Again, as I said, the fever over 100, repeated shaking and chills, muscle pain, headache, sore throat, a new loss of taste or smell, whether you had unprotected contact with a COVID person, a known COVID person within the past 14 days, or you've been tested and you're awaiting results. So those are some of the things that changed from day one. Excuse me, 1 second. I have to take a drink there. From day one, we did increase our cleaning schedules, and I recommend that highly to all the businesses who are reopening for yourself and your business, but it's also the perception of your customers. So they'll be very on heightened awareness and watching to see the cleaning schedules of everyone. So we had increased cleaning schedules to our patient areas and our common areas, increased hand sanitizers available throughout the hospital. I'm sorry, I apologize, my voice is cracking. Social distancing. We do have markers throughout the hospital for 6 foot apart, and places that I've been to recently, I've noticed have that in place, so I highly recommend that. We have masks required for all who enter the hospital right now at this point, and we'll continue to reevaluate that. Our visitation policies had changed. We discontinued visitation completely to avoid additional exposure to the COVID virus. We had signage developed, which that has helped us significantly, so I highly recommend that in your businesses when you're starting out, to give people an idea of what the expectations are prior to entering and while they're in your facility. We put up sneeze guards, which are clear pieces of plastic that help prevent the transmission of any droplets between patients and our staff. And one of the things we also did is put in, developed twice a day. We do safety huddles every day anyway, but we added an additional one in the afternoon, not just the morning one. So we did safety huddles in the morning and the afternoon. This gave our staff the opportunity to communicate any concerns that they had, anything that we needed to make changes on that's not working. So communication is a key part of this whole process, and really just respecting everyone's rights, and especially now during this reopening phase.
And I want to say, Anne Marie mentioned signage. There is a great tool on the U.S. Chamber website, and I'll make sure we get that link and post it, that just says, my business is currently following these safety procedures, and you check the boxes, and then it develops a nice poster for you, a nice sign for you that you can hang up. So that way your customers coming in know, I should wear a mask upon entry. I need to, safely social distance. They only want, some stores are only requesting one customer come in at a time if they're doing takeout orders. So I know a lot of our local pizza places are asking, only one customer in the door at a time. So I think those posters could really help your business and help you with the wording. Because I know sometimes I've had some questions from local businesses about how should I word this on my poster, right? Because I don't want to offend anyone who may not be able to wear a mask if I'm saying, masks are required. Because there was, there were some people that were concerned about that. Anne Marie, it sounds like you've made a lot of changes to the hospital procedures. What changes do you expect to be permanent changes, and what changes do you see maybe lifting when some of those precautions are lifted?
Well, it's funny you ask that, because the one thing we've learned here at the hospital is nothing is permanent, and we've made changes probably to just about the way we do everything going forward because of the COVID virus. And I think that's increased our awareness. And I think the key thing is patient safety is our most important goal, and whatever we need to do, we will make sure we do it, and we do it effectively. So one of the things that I am concerned about is the perception of our community, our hospital members here. We need to make sure to be consistent. I like the idea. I think that's great that you're providing the signage, because consistency we've found is very important, and it's helped us to maintain compliance with some of the changes that we've made. But any of the things that we're doing is, again, to prevent the spread of COVID. So I do want to mention that as of yesterday, there were 500 new cases in Pennsylvania. 27 of those 500 were in northeastern Pennsylvania. We had one in Wyoming County. So it is still in our area, but not in the prevalence that it was before. So we're just asking everyone in our hospital to make sure that we're still consistent doing the cleaning processes that we put in place. For right now, we just want to make sure that everyone feels safe in coming to the hospital, and they can receive care in a safe environment. And we're encouraging patients not to delay care, especially in an emergency. What we've seen recently is some people are delaying getting care because they're afraid to come to the hospital. But honestly, with the measures that we've put in place, such as the cleaning processes and the precautions, such as the mask wearing, hand washing, and things of that nature, it's actually made the hospital one of the safest places. So we're very happy to know that, but we're keeping the preventative measures in place for right now until we monitor the situation and determine that the COVID virus is definitely under control, or maybe has been eliminated for our time now. So our goal is just to make sure we keep our patients safe.
Very good. Another question that seems to be coming up a lot lately is, do we need to wear a mask outside, right? The weather is hot, and I see this kind of mixed reviews on this, right? So I see people, as soon as they walk out of the store, taking their masks off, and then I see people at the park wearing masks. So what is your take on this, and can you help us to understand when a mask is important, and when we can maybe not wear the mask, even if we're out in public?
Sure. One of the key stress, though, is going green does not mean that all precautions are lifted. Going green means that we're opening our communities and our businesses, which we really needed to do. I mean, we've had a long period of time that people were out of work, businesses had no revenue coming in and everything. Now's the time that we need to get started again, but we need to do it the right way. So going green means that we're reopening. It does not mean that all the precautions are lifted. So I don't know if, I've been in stores like Home Depot, Lowe's, things like that. I've worn my mask in the store. I see just about everybody in the store, I think, is wearing masks, taking the precautions of social distancing. I honestly feel personally that that is a comfort to me in going into those stores. And I think that as a business owner, that's what you need to recognize in opening up, is what is making your customers feel safer coming in. So certainly, I think in large gatherings, mask wearing and social distancing is very appropriate. I've also seen people driving around in their cars with their mask on by themselves. That, I think, is a personal choice. If that makes you feel comfortable, then I think that's what you need to do. But I think we all need to be respectful of those persons who want to wear the mask to make themselves feel comfortable and be protected. I think we're reopening. We have to take it slow and continue the precautions of the masks and the social distancing, the hand washing, and things of that nature to prevent a further reoccurrence. We don't want, that's the last thing that we want to happen. So certainly if you're in crowds of people, I definitely encourage you to wear masks. Crowds of people that, you know, you're not your family members, people that you know that you don't know have been exposed to COVID. You need to monitor your environment and know where you are at all times and have that awareness. You had asked about like in parks and things like that. It is open areas, but again, in parks, I don't know what the cleaning schedule is of, you know, the swing sets or the slides or things like that. So be very aware of that with the hand washing, or have hand sanitizer with you at all times.
I think that's good advice, and mainly what I'm seeing people do. I think that, you know, when you are outside and in an outside space, you can social distance more easily than you can inside a store where people are kind of coming up to you. So I think that it's just good to be aware of, and like you said, it is personal preference. So if you are in an outdoor space and you want to wear your mask, I think we need to respect those people that do.
Definitely.
A recent article I read and that has been circulating a bit is that it's unlikely that asymptomatic COVID patients are spreading COVID. So people who are asymptomatic but may have COVID, it's unlikely that they're spreading it. Can you talk about that article if you read it, and maybe share a little more about that?
I actually just read an update to that article. Apparently, the World Health Organization had put out information that people who are asymptomatic with the COVID virus are not the ones who will spread the COVID virus. I just read an update actually this morning, and my understanding is that the World Health Organization has clarified that, and the scientists have determined that have not determined yet how frequently people with asymptomatic cases of COVID-19 pass the disease on to others. There is more information to come on that. So in all actuality, the bottom line is there is no definitive answer that asymptomatic people with COVID positive can or cannot transmit. So we need more data on that and more research. And that's the phase that we're in now. When we look at other studies, some of the studies go on 3 or 4 years. It seems like COVID has been going on forever, but in all actuality, it's a few months. So that it is new, in a new process for all of us. So I think you're going to see more and more information coming out in the coming months. So we need to keep on top of this and make sure that we're all aware of the changes. I mean, no better example than the World Health Organization changing their stance from saying one day asymptomatic patients cannot transmit it, and then the very next day withdrawing that statement. We need more research and ongoing research on this.
And it's definitely been hard, especially I think for the general public, because we don't understand the healthcare world, right? We're not educated in that area. So we're reading these articles, and we're reading them from reliable resources, and we're listening to the World Health Organization is putting this out, and then the very next day they're putting out something completely different. So I want to just take a minute and acknowledge how frustrating that is to our community, and how frustrating it must be for healthcare providers like yourself in the hospital, right? Because people will share that article over and over again that says asymptomatic people can't spread it, but will people share the retraction, right, of that statement? And I think that could certainly put a lot of us at risk.
That's why I really would like to emphasize the importance of not making sudden changes. I think we're all looking for answers, and we want to be able to give the answers, but there's some that, we just have to kind of wait and see and make sure that we have the appropriate data, and we're referring to that. I mean, we've made changes here in the hospital within 24 hours of some of the process that we have in place because we found a better process. So it is frustrating, and that's why we put the communication measures in place of twice a day, 7 days a week, whether it's a holiday or not. We've been communicating twice a day with all of our staff to make sure that they're aware of the changes. So the best thing we can do is take the responsibility on ourselves to find information out, and when we find out more information, spread that information, and any corrections within that, make sure that people understand there's a risk there. There's still a risk there, and we need to make sure that we continue to take the precautions, not discontinue them. And I can relate. It's especially now. It wasn't as bad wearing masks when it was 30 or 40 degrees, but now that it's 80 and 90 degrees, it's very uncomfortable. But you need to evaluate that for yourself, and know that we need to continue to take the precautions to prevent the spread. Now is not the time. We're into the reopening phase. We don't want to take a step backward.
Sure. Can you talk to us a little bit about masks versus social distancing? So lately, I've heard a bit about if you're practicing proper social distancing, staying 6 feet apart, if you're spread out in an area, then masks really aren't necessary, right? And again, this isn't my statement. These are things that I'm hearing from our community. But I want to get clarification from you about, what is your recommendation on that? Is there, is it an either or situation for masks versus proper social distancing?
Right. And I think now it's more important than ever to, need to reevaluate that. The CDC has not changed their recommendations of mask wearing and social distancing, but with the reopening and being out in more open spaces, I think we're at the stage when we need the personal responsibility that I mentioned before. Crowds such as community gatherings where you do not know who's been exposed, they haven't been screened or anything like that, so you don't know who you're standing next to. So you need the personal responsibility to make that judgment call yourself, whether you're social distancing. I mean, my recommendation is, eliminate the handshaking for sure. When you're talking to someone, just take a couple steps back, have a conversation. You could still have the conversation, take a couple steps back, to make sure that you have that distance between you. It is much different than what it was before. I'm a person who likes to hug. I've stopped that completely, and I have to have that awareness on myself all the time. So these are the things that people need to be more aware of. So I don't want to say not to wear masks and not to social distance. You need to evaluate the situation you're in. Like I said, if you're in crowds of people that you don't know who's next to you and things like that, I definitely would not recommend, as the CDC is still recommending wearing masks and social distancing.
Anne-Marie, this was not a question that was on the list that I sent you, but I'm going to ask, and if you don't feel comfortable answering, but I know many of us, especially our chamber, is looking at what does the future of our events look like? What does it look like for us to start holding our luncheons again or our leader cast events again, should we be, as an organization that is bringing people together, should we be screening? So if you come to a luncheon, would it be something that you would recommend we do, to screen people as they come in to gather?
I think that's an extra safety precaution, to screen people as they enter into larger groups, to do the temperature screening, question screening. You can do the questionnaire screening beforehand, you know, a little bit beforehand, and have the temperature screening on the way in. As long as people, you know, I think that will make people feel more safe coming to events, and that's a start. I do think before we have larger events, we need to get more information on how the responsive is of the COVID virus during the green phase. We know what it was during the red phase. We know what it was during the yellow phase. Going into the green phase, we don't have that information yet. So I think before we have large gatherings again, we need to just take a little time and make sure that there's no increase in prevalence of the COVID virus. So once we get that, I think different decisions then can be made. But for the initial stages, I would recommend less than 10 people in a group. I mean, the restaurants, you see smaller tables that are separated away from each other. Meetings that we've had here at the hospital, we've had less than 10 people, other people have called in. So I think everyone needs to know they need to phase into this slowly and figure out where we're at when we're in the green stage, because we don't have that information yet.
I think that's great advice, because one of the things that I'm sure you all have noticed is that in the yellow phase, it was gatherings of 25 or less. As we move into the green phase, that social gathering is 250 or less. And obviously there's a huge difference in that. So we as a chamber have decided to wait a bit before we start doing any events, but also really looking to, as Anne Marie said, what happens in this first month as we are in the green phase, and what does that look like, and what precautions are people taking, and also what corporate policies do our businesses have set in place. So Anne Marie, I imagine, and this will kind of be our last question, but as we are now in the green phase on Friday, what kind of policies have you seen come out from Commonwealth Health around attending meetings outside of the hospital for your staff, or attending functions outside of the hospital? And is that something that you think our local businesses should set policies around for their staff and their places of work?
I think going into the green phase, it means it's a reopening phase for us. That means, for example, in the past, we've postponed elective surgeries because we didn't want to expose anyone who had an option to have a surgery, not emergency surgeries by any means, but we've reinstituted elective surgeries, but with high precautions. Every patient that comes in for an elective surgery now will be COVID tested to make sure that they're negative, and then we can get the surgery scheduled. That will prevent exposure of our staff, contamination of the OR suite, which, as you know, going into an operating room, it's a sterile area. And it will reassure the patient that other patients that were prior to them have been tested as well. Now, certainly if we have an emergency patient, we do test them still, but we put full protective measures in place to make sure that the area is safe. But what I want to just reemphasize is that just going into the green phase just means that the county is reopening. It does not mean that the precautions that we're supposed to be taking have been lifted. I think now more than ever, we need to reevaluate as an individual, as our own business. We have smaller businesses in the area, we have larger businesses in the area, and the decisions that are made at the larger businesses will not be the decisions that need to be made at the smaller businesses. For us at Commonwealth Health, we will be monitoring any of our staff members. We're coming up on vacation time, and we're monitoring if they go out of the country before they come back to work. If they're out of the country, that's the outside of the 48 contiguous states. If they come back into the country, before they come back to work, they need to be tested for the COVID virus and get a negative test back before they come back to work. So that's some of the things that we're doing. We still have the option of calling into meetings here at the hospital or within our Commonwealth Health system. So I think we need to go at this slow before we start holding large gatherings and things of that nature. But I do, before we go, I just wanted to say thank you to our community in Wyoming County. I was just overwhelmed and amazed at the support that we received from our area businesses and some community members and the chamber as well. It was uplifting during a stressful time for our staff here and our physicians and everyone, to know that we have the community support, and we're continuing to ask for the community support in coming back to the hospital, because just like area businesses during the COVID virus, our volumes went down too. We're back, we're reopened, we're doing elective cases. We don't want people waiting for emergency care. The hospital is safe. We've taken every measure that we possibly can to assure that, and patient safety is our #1 goal. So we really want to make sure that we reach out and, for example, this call, reach out and make sure that we're helping the community just as much as the community has helped us during these past few months especially.
Well, I thank you, Anne Marie. Tyler Hospital has always been a very important part of Wyoming County for as long as I can remember, and I was actually born there. So I think that, for many of us in Wyoming County, Tyler Hospital plays a special role for us, and we appreciate your leadership and guidance of our hospital through this pandemic, which is something that I'm sure that hospital has never seen before, and none of us have ever seen before. It's been certainly a time to reflect on our organizations and how we operate. And as we get into our rebuilding phase and the rebuilding of our community, we wish our healthcare, and especially our local hospitals and local healthcare offices, the best. And we really do appreciate what you've done for us, and we'll continue to bring opportunities for you to speak to our community, because I think it is very important to have your expertise at the table when we are discussing what rebuilding our community looks like. I'd like to take the time to thank everyone who joined us today on the call. If you have questions for Anne Marie or myself, please don't hesitate to email them to me. I could get them to Anne Marie for you. We appreciate your time. We look forward to watching as your companies rebuild and to be here for you every step of the way. Thank you again for joining us, and I hope you all have a great day.
Thank you.
Bye.